everyone, and welcome to Coffee and Colleagues at RD Psychotherapy, where we're going to be discussing and collaborating with different healthcare practitioners, whether it be in mental health or physical health, where you get to ask all the questions you've always wanted to ask your healthcare practitioners, but were way too scared to ask. And we'll be having different guests throughout our shows and topics, and feel free to send us your questions, and we will gladly answer them, given that they're appropriate.
So welcome to today's first episode, and our topic is going to be Mythbusters. My name is Dr. Anna Grutchik, and I'm a naturopathic doctor.
My name is Brianna Urquhart, and I'm a registered social worker.
And my name is Diana Romero, and I'm a registered psychotherapist, and we are all based out of Ontario. So Anna, talk to me. You are a naturopathic doctor, but many people consider you a witch doctor. So why don't we debunk that? What is the difference?
Yes, so a lot of people think we are witches and we have cauldrons.
You don't?
No, this is not true. And a big misconception is that our degree is something you just do online, and that's not true. You need a 4-year bachelor degree, and then you go on to one of the accredited colleges in North America. So I attended the Canadian College of Naturopathic Medicine, and it was very much in person and required at least 40 hours a week. And yeah, then afterwards you do a lot of licensing exams because they need to make sure you can take care of people.
So you're not a witch doctor?
No.
Well,
But do you still do, like potions? You don't need a cauldron for those. So do you potions? Do you tell people to do incantations, say this on a full moon?
So there's no incantations, but there are some botanical herbs that we use, and you can steep in a slow cooker, but no spells or anything that needs to be casted upon them.
So then if someone wanted to go see you, what exactly would they be going to see you for, and how would you attend them?
So as a naturopathic doctor here, specifically Ontario, we have the privilege of being your primary care physician. So it can be
awesome.
It can be any type of concern. People of all types of ages. I would say that mostly you see people kind of at their end of the straw, but some people are coming more preventatively. So I like to look at gut issues, skin issues, and a little bit of everything right now.
So you can look at like autoimmune disease,
Yes.
infertility,
Yes.
cancers.
So with cancer, it's supporting people with cancer.
So like they're oncologists.
No, not oncologists. So,
Okay.
so with infertility, there are a lot of naturopathic doctors that will work in combination with fertility clinics, specifically the use of acupuncture and fertility. In cancer support, there are a lot of doctors that support people with cancer. We do not treat cancer, we support cancer, and there are a lot of IV intravenous therapies that people go to.
Awesome. Okay, well that's actually good to know that you can actually be people's primary care physicians.
Yes.
They're not just mandated to only see a medical doctor. And again, we're not against medicine.
Mm-hmm. No.
We fully believe that medicine is important and it's always had a place in society. Yes. But I know naturopath has been way around way before, all medicine began from a naturopathic aspect. So.
And that's also a common myth where you have to choose. You do not have to choose between your ND or your MD. You work collaboratively.
That's awesome.
Mm-hmm.
And then you, Brianna, you are a social worker, so you steal kids.
Yes.
100%. That's
okay.
Bread and butter. No. All the time I get that. But the truth is a lot of social workers have nothing to do with child protective services, which is where people get the child stealing from, is Child Protective Services here in Ontario, something like CAS, Children's Aid Society, which one step further from that, most or a lot of CAS workers aren't even social workers at all.
Okay.
They're case workers, so they have nothing to do with us. So to call yourself a social worker, you have to be registered with the college, and similar to you, there's a very specific education background that you have to have. So many of us have nothing to do with Child Protective Services. They're kind of a side topic. There are apprehension issues in that field, but like me, I've never worked in Child Protective Services at all. It's never been something of interest to me, but we work in a wide variety that have very little to do with that.
So what exactly do you do then if you're not stealing children all day?
It's hard, right? If you can't steal kids, what can you do? A lot, and the answer can be a lot. So here at RD Psych, I do case management, psychotherapy, collaborative group programming, things like that. Social workers can also work in the legal system. There's a lot of advocacy. A lot of what we do is not just helping you find resources, which is the majority, is seeing what you need and then helping connect you to different community supports, family supports, your own strengths, but a lot of advocacy then on your behalf or alongside you to fight for what you do need that you don't have.
Perfect. That's awesome. And then I'm a registered psychotherapist, and we read minds.
Yeah.
And so it was great. When I was in school, every date I went on, every guy would ask me if I could read his mind. And, and then now every person I see, whether it be like out for dinner or just hanging out, the first thing I hear people say is, "Oh, I don't want to talk to you because you're going to read my mind." I'm like, no.
You know what I'm thinking right now?
I do, but I'd rather not say it out loud. We're live. No, realistically speaking, as a psychotherapist, no, we don't read minds, unfortunately. The good Lord did not give us that gift. But our job is to help figure out what's actually on your mind when you can't actually put it into words. So we work in the aspect of dealing already with a mental health diagnosis that already exists. Because in Ontario, psychotherapy is when there is already a diagnosis that exists, and then which has already been given by either a medical doctor, a psychologist, or a psychiatrist, and then from there, or even a naturopath. If the naturopaths, are you guys allowed to diagnose mental health issues like depression, anxiety?
We use scales, yeah.
Yeah, okay.
Yeah.
So once we have an official diagnosis, we are allowed to sit with the patient and then provide treatment for that diagnosis.
Yeah.
If the individual does not have a diagnosis, then that is not psychotherapy. That's actually more self-actualization, which is fine because it basically means that the person is in a good spot and they just want to know on how to further grow. But no, we don't read minds, which at times is unfortunate because when a patient is unable to tell me what they're really feeling or what they're thinking, it can sometimes turn into guessing games when they don't have the words to put it into language. So our job is to help you find that so we can help you deal with what you're dealing with, so we can give you coping strategies, because a therapist is not a strategy. A therapist, is not a coping skill. We are simply a strategy so we can help you learn your coping skills, but that's all we are. We're nothing more than that. So it's not like, dial a therapist. I broke a nail. I'm in the grocery store. I'm having a breakdown. Let me just call my therapist and they'll help me out. It doesn't really work that way, right? Unless you're an emergency therapist. You basically see us once a week or once every 2 weeks. We sit, we talk, we give you coping skills, and you move on. But we are not a coping skill.
And I think that is important to state and reflects on all of our professions, where what we do with you, nothing is 100% guaranteed. We're here to provide you with strategies so that you don't have to see us every single day or once a week for the rest of our lives.
Yeah, and I think even just not only 100% guaranteed, but not 100% of the time. Sort of like you're saying, it's not a forever, it's not a solution, it's a strategy. You give coping strategies, you move on, and then they have to act on those. Yeah. Same with social work. I can give you resources, but then you are the one as the client who contacts them, who utilizes them, unless you need some more support. The goal is not to have me forever.
Exactly. And that brings us to the myth number 2, which is which we're trying to debunk, which none of us are 100% guaranteed. Someone cannot just come up to you and you fix them overnight. Same with you. Every strategy you give an individual resources does not mean it's going to work. And every time someone comes and sees me does not mean I'm going to fix your problem. None of us, and like you said, are able to do that. We just provide you with coping strategies, and it is fully up to the individual to decide what to do with them. If you choose to do nothing with them, then there's that old saying, if nothing changes, well, then nothing changes, right? But if you choose to be proactive, you have a higher success rate. Again, it's not a guaranteed rate, it's just a higher rate that it can work. So that is awesome. All right, and then moving on to myth number 3. Dr. Anna, do you have perfect health? Because you are a naturopath doctor. So I'm going to assume you are perfect, you have no health issues.
And you never do anything unhealthy.
And you don't drink, that's not coffee you have there, that's purified water.
It's probably like kombucha, right? No,
no purified water.
I think it's a huge misconception that apparently I don't enjoy my own life. And it's funny.
Or you don't mess up your own life by doing something you shouldn't be doing.
I have patients who will come to me, and when we start talking about diet, they start apologizing to me prior to, they're like, I'm really sorry, but I drink a coffee. And I'm like, yeah, I'm on my third one today. Like, you know, like, oh, we had pizza last night. I'm like, yeah, I'm human too. I went to a party last night too, and we had pizza. It's not true. I like to live my life 70-30. 70% of the time we're on, 30%, you know, we have fun. And I think that's how you have to live life. Because if you lived it 100% strict, I don't think there's much joy in that. So, no, I enjoy my things just like everyone else does.
I really like that split, 70-30. That's a really good way to put it.
Yeah, I guess because it leaves you room to be human.
Yes.
Like, and I get that because I know as in healthcare, yes, people are actually quite surprised when I don't have it all figured out because they believe as a therapist, I don't have any problems with anybody. My relationships are great because, right, I spend all day talking to people, so I have great communication skills. And I do at the office, but outside, it's like one of our staff members said, I don't, you know, what's it the word we use? When our people constantly think we're
Therapized?
We're not therapizing people all day. I don't go out with friends and be like, so what is it you said there? Hold on, let's discuss this. And I don't whip out the DSM and we start.
Last week when we had coffee, you said,
parrot it back.
How are you feeling about that now?
Yeah, exactly. Brianna, did you follow up on that? Like, no, I don't. No. The problem, I think, and maybe you guys experienced that when you were first in school, you were always on. And then at some point, you had to learn on how to turn it off because it almost became like neurotic behavior.
Yes.
And it was exhausting. It was exhausting talking to friends and family. And I know you were saying you probably have people, you're out maybe at a party and they find out you're a naturopathic doctor. They're like, I have a question to ask you. So I have this rash right here.
My gosh,
and this one under here. Could you take a look and let me know?
That leads to another myth. Like, we are not on all the time. We finish the day at 5 o'clock and other times too, and not on the clock all the time. Nope.
No, I think it's exhausting, and I don't think people realize that we have real lives.
Families.
Yeah.
Yeah.
And it's just the same way you being a social worker. You don't have constant resources at hand to fix all your problems as well. Nor are you out handing them out like trick-or-treat candy.
Exactly. It would make my life a lot easier if you were to say, hey, you know, I need this, and kind of like the Sherlock mind map where I just go through the door and I'm like, oh, it's all right here, right? Hamilton is one city. I work in multiple cities. I don't have everything completely mapped out. Also because things change. And that's everything changes, and we don't have all the answers. Same as if a friend comes to you and goes, so here's all my problems, what is wrong with me? Or what can I do to fix it? You don't have all the answers.
No.
Because you don't have the whole story, because we're not on, and it's personal. And same in that, I wish I had all the answers. It would make all life a lot easier, but we don't.
We don't. And I think, and like Dr. Anna just said, part of for me is it's just that after work, I am not on anymore. So when I go out with friends, I have actually told them before, I am not on after work. If you really do have a serious problem within psychotherapy, we're actually not allowed to produce psychotherapy for our friends or family. However, if we are friends, I am allowed to be your friend. And as a therapist, I can give you friendly, professional advice. Because, you know, like in jail, everybody's a lawyer. Exactly. So on the outside, that is all I'm giving you is education. But if I have a friend who comes and says, look, I have this really serious problem, I always start with, understand this is not therapy. This is not professional advice. This is just so happens to be that I am a therapist, so I'm giving you education. But anything I say and do here, you will not use against me.
No.
And
liability.
Yeah. And if it works for you or not,
you
know, Bob's your uncle and that's it. But I actually try very hard to steer away from that. Because I have had friends who every time they call me, it is like, you know, dial a Diana, and no, and it's exhausting. So I think in physical and mental health, you have to know when to leave your friend alone and treat them as your friend. And if someone continues to do that to me, our friendship is over because I need to start charging you.
The boundaries are so important there. I think sometimes part of the reason that myth exists is because we struggle to put those boundaries up. Yeah. Because, you know, like you said, in school, you're 100% on. Social work, if you do, especially both, so BSW, bachelor, and an MSW, but for the BSW, it's broader at the beginning because social workers do so much. So every time something comes up that is unjust or isn't right, you automatically want to jump in. But if you do that every time, it's exhausting.
Yeah, no, it is.
It's just going to lead to burnout.
And that's, I think, a good point to understand that you can actually burn your friends and family out if they are a part of the healthcare field with the constant, because it gets to a point where it becomes from concern to pestering if you're constantly asking us. So I tell that to all my friends and family, and even to my patients. I tell them, when you see me outside, I will not acknowledge you, because we can't unless you acknowledge me first. But if you want to tell your sister that I'm your plumber, I can't say any more than that. I'm like, cool, I won't go to your house to do your plumbing, but if it makes you feel better to say that. But that is a myth. I know people feel that we are constantly on, and no, we're not. I like to go home. I like to watch movies. I don't just watch, all mental health stuff. I don't read all day, all mental health stuff. No. I like to go for walks. Yes, I like to eat pizza sometimes too, gluten-free.
I think the ultimate thing there is that, like, we're all still human.
Yes.
And that gets surprising sometimes, even with, say, when you disclose something when it's appropriate, sometimes you see the shock there.
Yeah.
Because I've actually had clients be like, oh, so, like, you have this problem. It's like, yeah, I'm human.
Yeah.
You can't be in a relationship and never have a communication breakdown.
I wish.
Right? I wish. That would make life great. But just because we talk about it, or just because I help someone find, or like coach someone to advocate for themselves, doesn't mean I don't get stressed out having to do it for myself.
Which then I think brings us to myth number 4, education.
Yes.
I think we should all talk about where we actually got our education from, and the fact that we are registered, and many years ago people could just put up a shingle and call themselves whatever, and that was it. And I know we discussed this beforehand, which was last week, which talking about why it's important, and I know we'll discuss that in the next segment, but part of the myth buffer today is understanding what it is to have you be with someone who is registered, and where our educations came from. So where did you get yours from?
So education, I went to Wilfrid Laurier for my bachelor's, and then for my Doctor of Naturopathy, I went to the Canadian College of Naturopathic Medicine in North York, Toronto, and then I am registered with the College of Naturopathic Doctors of Ontario.
Which is an accreditation board, which is our license.
Yeah, license, they give us our license, they let us practice, see if we're competent through a physical exam, a written exam, jurisprudence, police check, all the fun things. It's very expensive to keep your license as well. And then we are also members of our association. So I'm a member of the Ontario Association of Naturopathic Doctors, as well as the Canadian Association of Naturopathic Doctors.
That's a lot.
Yeah.
You?
So I went to University of Windsor for an honors double major, social work and disability studies. I'm continuing education, so hopefully to be finding out soon to be going into my master's of social work. Also done a bunch of other programs, but those are the main accredited ones. So with that BSW, I'm registered with the Ontario College of Social Work and Social Service Workers. Everyone uses the abbreviation because that's really, really long. Similar to
the abbreviation is still really,
it's
really
still
long.
really, really long. OCSW, SSW.
I cannot remember that. I'm just like the OC, whatever.
The letters.
Yeah, the letters.
But similar to everyone at the table, with that licensing, there's the when you go on the website, we're all listed, so you can search my name and it's there. If your social worker's name is not there, they are not registered and they cannot call themselves a social worker. We do continuing competency program every year, same thing, background checks, criminal checks, references, a lot of money. We also have a provincial and a federal association of social workers, and yeah, I think that's me.
So I went to school, I actually went to a Christian university here in Toronto, to Canada Christian College, and I got my BA there in psych. A lot of people actually don't know that. Every time I say, I went to school in Toronto, they automatically assume UFT.
Yeah.
I said I went to school in Toronto. I never said the University of Toronto. Then I went to New Brunswick, and I got my degree there from Yorkville University, and we actually have, all our interns are from there right now, for the Masters of Art in Counseling Psychology. And then I went to the University of Liverpool in England, and I did my forensics there. However, I fully haven't finished the thesis on that, only because I almost died when I was writing my thesis.
Just because.
And that kind of totally
Sidebar.
Yeah.
Some things.
Yeah, trauma. So kind of sidebar, but I gotta finish that. And then after that, and then I just got accepted into the doctorate program at my alma mater, which was Yorkville, and that should start in January.
Oh,
and then, I got accepted actually for September this year, but I had to push it now until January. But same thing, Then I had to apply to the College of Registered Psychotherapists of Ontario. Those are the individuals that hold my license. And just like everybody here, have the license, have the insurance, have the criminal check, have the money, because we have to pay for all of this. And same thing, if you look us up, any of us for our respective colleges, it will tell you if the person is active and in good standing. What you always want to look for is the good standing part, because a person could be active and under disciplinary or under a restrictive license, right? And then you want to look as to why. Sometimes there is a case there, and sometimes there just isn't. And sometimes patients can be very litigious and malicious, and so but naturally the colleges were invented not to protect the practitioners, but to protect the public from unsafe practitioners. And so you always want to investigate that when you are looking for a practitioner in any healthcare related field. And that's why it's so important you ask about licensing and education and insurance, because in the event that something would happen and they don't have insurance, well, you're kind of out of luck. So it's highly important you always check all these things. And here at the practice, where we get checked every year anyway, to make sure that none of us are out there like killing puppies or anything of the crazy sort. Which is So I think, did we cover all of our myths today?
I think so.
We did,
Yeah. So those are the myths generally that we get asked. So
I think so. So if we missed any myths, or there's something you're thinking of and you want to know if it's true or if it's not true, let us know in the comments. So this series is going to be fairly regularly. I don't think we've determined how often, but you'll want to make sure that the bell button is on so you don't miss them when they do come out. This is also where RD Psych's Facebook Lives are going to be transitioning to cross-platform lives, and we'll have other videos as well. So make sure that you're subscribed. Give this a like if you enjoyed it, and we'll see you at the next one.
Thank you guys for watching. Have a great day.